Hello, hello, hello. That reminds me of adieu, adieu, adieu and the Sound of Music. Opposites, but reminiscent nonetheless. You've tuned in to Menopause Your Way. And boy, do I give you every which way to manage your menopause. This is video 177, and it's part of our unit on heart attack. If you've got my book, whether you have the first edition or the second edition, the entirety of chapter 28 is on heart attack, and we're addressing the second half of that chapter with all the management options for lowering your risk of a heart attack. And the category for today is hormonal medication options. Now, this video is critical, not only to your understanding of heart attacks in women, but also to set the stage for the next 3 videos. Every woman, no matter what her age, should watch this video. It's the kind of information that will serve you well for the rest of your life, no matter how you choose to manage your menopause when the time comes. My videos have a definite order. I'm exquisitely pedantic about the order. I spend hours planning them in just the right order so that you don't have to do anything but watch them in order. Everything I do is to make your life easier. So let's get started on this topic of hormonal options for preventing a heart attack. First, we'll start with a review. On many occasions, I've told you that heart attacks are the biggest killer of women. Statistically, heart attacks kill 1 out of every 2 women. Heart attacks kill more women than all of the cancers combined. So all women, no matter how healthy, are at somewhat high risk for a heart attack. And the time when your risk for a heart attack becomes high is post-menopause. And by definition, post-menopause is when you lose your estrogen. So there's an obvious connection between estrogen loss and heart attacks. Or, to look at it from another perspective, there is an obvious connection between the presence of estrogen and the absence of heart attacks. So that forms the basis of hormonal medication options as a means of preventing a heart attack. On numerous occasions, I've explained hardening of the arteries. This is what your arteries are like before menopause. And what happens to keep them soft and supple like this? You have estrogen surging through your body. Estrogen is what keeps them soft and supple. When you lose your estrogen, your arteries begin to harden. They become more like this hose, a little stiffer. And the longer you go without estrogen, the harder they get. I've explained that this hardening is the result of fat and calcium building up inside the artery. So that forms the basis of our topic today. The logic is simple. If loss of estrogen is what increases your risk for a heart attack, then continuing to take estrogen will prevent that increased risk. And notice that I'm only talking about estrogen right now. I'll get to progesterone in a bit. So regardless of how or when your post-menopause comes about, when you lose your estrogen, that's when your risk of heart attack starts to climb. Back in video 162, I taught you that all the fats, also called lipids in your blood, are not the same. I taught you that some are good fats and others are bad fats. Obviously, you want a lot of the good fats and very little of the bad fats. And before post-menopause, that dynamic between your good fats and your bad fats is favorable. In fact, the younger you are, the better it is, generally speaking. But loss of estrogen changes all that. When you lose your estrogen, your good fats decrease and your bad fats increase. And the result is that the rate of heart attack increases exponentially at the time of post-menopause. If you experience premature menopause at the age of 30, your risk of a heart attack starts to skyrocket at age 30. And if you have your ovaries removed at age 30, your risk of a heart attack starts to skyrocket at the age of 30. If you had chemotherapy that causes your ovaries to stop functioning at age 30, your risk of a heart attack would start to skyrocket at age 30. And if you had radiation therapy that destroys your ovaries at age 30, your risk of a heart attack would start to skyrocket at age 30. So you get the picture. While your risk for a heart attack is lower the younger you are, it's the loss of estrogen at any age that causes it to increase exponentially. So, if you replace estrogen when it's lost, you can prevent that increase in your risk for a heart attack. It makes sense, doesn't it? If you've been watching my videos, you know that there are many different kinds of estrogen. There are pills and pellets and shots, skin patches, skin gels, lotions, sprays, vaginal rings, vaginal tablets, and vaginal creams. In video 33, I explained them all. And later, when we discussed the estrogen window of opportunity in videos 80 through 90, I taught you that some of these estrogens travel throughout your body and provide estrogen to your entire body, while others confine themselves to your vagina and only treat your vaginal symptoms. Well, we're talking about your heart here, and your vagina is a long way from your heart. So it's important to know which estrogens can prevent a heart attack and which ones can't. When it comes to using estrogen to prevent a heart attack, the only estrogens that suffice are those that travel throughout your entire body. These include all of the following: pills, pellets implanted beneath your skin, shots, skin patches, skin gels, lotions, sprays, and the FEM ring, vaginal ring. What this means is that the other vaginal ring, called the S-string, vaginal tablets, and vaginal creams do not suffice for preventing a heart attack. In videos 80 through 90, you also learned that in order to help reduce your risk of heart attack, the estrogen you take must meet a certain minimal dosage requirement for that particular type of estrogen. If you take a dosage that is lower than the designated minimal dosage, it will not provide that benefit, even if it suffices to alleviate all your symptoms of menopause. So here's a chart reflecting those minimal necessary dosages. I won't go through the details of this chart. You'll have access to it later and you'll be able to print it out. Right now, I want to continue with the line of logic for using estrogen to prevent a heart attack. In videos 98, 99, and 100, after I had introduced you to the estrogen window of opportunity, you learn that there is a primary reason for taking estrogen and a secondary reason for taking estrogen. The primary purpose of estrogen is to alleviate severe symptoms of menopause. Preventing a heart attack is only a secondary benefit, a perk. So estrogen does decrease your risk for a heart attack, but doctors will not give you estrogen specifically for the purpose of preventing a heart attack. If you take it for your symptoms of menopause, the secondary perk is that you also get the benefits of lowering your risk of a heart attack. Do you see how important it is to watch these videos in order? Oh, but different kinds of estrogen have different degrees of benefit for your heart. Now, when I say that, don't go exaggerate the significance of the differences. It's just that when it comes to your heart, having some estrogen is better than no estrogen, but the different types of estrogens can affect your lipids differently. For instance, Oral estrogen pills increase your good HDL and decrease your bad LDL, but they also increase your risk for blood clots a little bit. And skin gels and lotions and sprays increase your good HDL and your triglycerides, and they decrease your risk of blood clots, but they also increase your glucose. Estrogen patches decrease your risk of triglycerides and your risk of blood clots. Trade-offs, trade-offs. It's all about trade-offs. But the most important thing of all is this: timing. Estrogen decreases your risk of heart attack only if you take it very early in your post-menopause, when you haven't been without estrogen for very long. And if you have been without estrogen for a very long time, it can actually increase your risk for a heart attack. Videos 87 and 88 were all about the meaning of the 5 to 10 years you hear associated with the estrogen window of opportunity. It's the time when starting estrogen is more beneficial than risky. And it's all about how hard your arteries have gotten. The longer you've gone without estrogen, the harder they are. And the harder they are, the higher your risk for a heart attack. So generally speaking, women who start taking estrogen in the very early years of their postmenopause, when their arteries are still nice and supple, keep their risk of heart attack very low. And women who start taking estrogen more than 5 to 10 years in their postmenopause, when their arteries have already gotten significantly harder, may increase their risk of heart attack. You see, there's been a lot of confusion on this, and that's why I'll be giving you more videos on the topic of estrogen and heart attacks. That's why I've told you to watch this video first and be sure to watch the next 3. Alrighty, now for progesterone. Progesterone is just a piggyback. You only need to take progesterone if you have your uterus. Its only purpose is to protect your uterus. It offers no specific benefit to your heart at all. But just as there are different estrogens, there are also different progesterone. And your heart tends to like some of them better than others. When it comes to your heart, you can divide progesterones into 2 groups. There's the bioidentical or natural progesterone that is the same progesterone your body produced, and these are called progesterone, micronized progesterone, or USP progesterone. And there are synthetic progesterones that are not identical to the progesterone your body produced, and these are called progestins. Now, progesterone is not like estrogen. It does nothing to reduce your risk of a heart attack, but your heart just tends to play favorites. It tends to like the natural bioidentical progesterones better than it likes the synthetic progestins. But that preference is not because it has anything to do with preventing a heart attack. You just have to put little tidbits like this into perspective. That alone is not enough to determine the progesterone you choose. Progesterone is important for your uterus, so don't let what your heart likes impair what your uterus likes. It's just one of many factors that goes on the scale as you weigh and balance your options. And as I've told you before, nothing, absolutely nothing, has all benefits and no risks. Everything has both advantages and disadvantages. Okay, so the lesson for today is that estrogen is an option for reducing your risk of heart attack, but it only does so if you take it early in your postmenopause. I've bombarded you with a lot today, but if you've been watching my videos regularly, most of it was probably old news to you. If you're new to my channel and you're just starting with this video, you're probably so confused that your head is spinning. I am not a head spinner. I promise that if you're confused, it's because you're not watching in order. Next week, we'll discuss the studies that have put us where we are today with regard to our knowledge about menopause and heart attacks. You won't want to miss that one. I'll take you for a walk through history that will make it all so clear to you. Oh, and if you want to print out the chart that I showed you today, you can. You have two options for doing so. You can click on the link just below this screen, or you can go to my website, which is menopausetaylor.me. Okay, subscribe and follow me on, Facebook, Twitter, and Instagram. And I'll see you in a week. Bye.